Diabetes insipidus. Diabetes insipidus, DI. Types and causes of DI. Central. Nephrogenic DI. Symptoms and signs of DI. Syndrome of inappropriate ADH secretion, diabetes insipidus, DI. DI is a disorder resulting from deficiency of antidiuretic hormone, ADH, or its action, and is characterized by the passage of copious amounts of dilute urine. It must be differentiated from other polyuric states such as primary polydipsia and osmotic diuresis, diabetes mellitus. Types of DI. Central DI is due to failure of the pituitary gland to secrete adequate ADH. Defect in hypothalamus. Defect in pituitary stalk. Defect in posterior pituitary. Nephrogenic DI results when the renal tubules of the kidneys fail to respond to circulating ADH. Psychogenic polydipsia. Physiological ADH inhibition, causes of central DI: brain tumors, head trauma, post-neurosurgery. Lung cancer, leukemia, lymphoma most common. Head trauma. Post-neurosurgery. Idiopathic, 30 to 50%. Pituitary atrophy, possible autoimmune. Congenital. Mutations of ADH gene, usually autosomal dominant. Infiltrative diseases, such as sarcoidosis. Causes of nephrogenic DI. Acquired. Drugs, lithium, amphotericin, gentamicin, loop diuretics. Electrolyte disorders, hypercalcemia, hypokalemia. Renal, obstructive uropathy, chronic renal failure, polycystic kidney, post-transplant, pyelonephritis. Systemic processes, sarcoid, amyloid, multiple myeloma, sickle cell disease, pregnancy. Congenital, rare. Present in first week of life. V2-ADH receptor defect, X-linked recessive. AQP2 water channel defect, will respond to ADH. Symptoms and signs of DI. Polyuria greater than 3 liters in 24 hours. Sudden onset more typical of central DI. Nocturia. Polydipsia. Dilute urine, urinosum less than 200, low fixed specific gravity urine. Anorexia. Dehydration, hyperthermia, when access to water limited. Symptoms and signs of DI. Diabetes insipidus can cause dehydration, which can lead to dry mouth, muscle weakness, hypotension, low blood pressure, rapid heart rate, weight loss. Symptoms and signs of DI. Diabetes insipidus can also cause an electrolyte imbalance, hypernatremia, hyperchloremia. Electrolyte imbalance can cause headache, fatigue, irritability and muscle pains. Seizure secondary to hypernatremia can happen. Treatment: desmopressin administration. Desamino-desarginino vasopressin DAV. V2 selective analog. Little vasoconstrictor activity. Drug of choice in diabetes insipidus. Administration: oral, subcut, nasal spray. Syndrome of inappropriate antidiuretic hormone, SOD. The syndrome of inappropriate secretion of ADH, SOD, is characterized by non-physiologic release of ADH, impaired water excretion with normal sodium excretion. SOD is associated with disease that affects osmoreceptor in the hypothalamus. Causes: tumors. Most common is small cell cancer of the lung. Brain dash. Meningitis. Cerebral abscess. Head injury. Tumors. Lung. Pneumonia. Tuberculosis, lung abscess. Metabolic. Drugs. Pathophysiology, fluid retention, serum hypoosmolarity. Sign is characterized by fluid retention, serum hypoosmolarity, dilutional hyponatremia, hypochloremia, concentrated urine in the presence of normal or increased intravascular volume, normal renal function. Hyponatremia and hypoosmolarity lead to acute edema of the brain cells. An increase in brain water content of more than 5 to 10% is incompatible with life. Symptoms and signs. Symptoms are headache, nausea, vomiting, impaired consciousness. Neurological signs: severe hyponatremia, drowsiness, disorientation, delirium, seizures, coma and death. Severe cases: